so we're going to go over the soft tissue component. We just went over the rehab exercise to improve scapular stability. What we're going to do here is we can get in and we're just going to get some lubricant right here. And we can use one of these tools. And we've got a nice little beveled edge here that will kind of follow the brachioradialis on a lot of people. We can start with the wrist extended, and then you can actually have the patient actively flex the wrist to increase the fascial tension in this area. And again, we mentioned before, you don't just want to treat right in the area where the pain is. We want to make sure that we remember that the fascia runs actually all the way down here. So you want to treat up into the triceps to address the fascia here, and all the way down the wrist here, okay? So the pain's going to be right in here. We want to make sure that we can actually use some of the other corners of the tool here and actually get in and work on the supinator. This can be very, very tender. You have to remember that you have the radial nerve breaking off into the superficial and deep branch. The deep actually penetrates the supinator muscle itself. So we want to be careful in this area, but having the athlete actively pronate is going to lengthen that tissue so that we can work on the supinator in addition to the extensor muscles to help treat this. We also have to remember that we've got to treat the flexors in here. So if we get in with the tool and we're actually working some of the wrist flexors, again, we can have the athlete extend, open up the hand, and work this. We can have the athlete start with the forearm pronated, and then they can actually supinate to get in there and work on the pronator teres itself to help free up the motion of pronation and supination to actually take the load off of the extensor carpi radialis brevis and potentially the supinator, which are most likely the source of your complaints. So, in review, you're going to want to make sure that you identify the correct structure. You're going to want to figure out if it is in fact intrinsic weakness of the hand, scapular instability, potentially neck, potentially abdominal instability. We didn't even talk about it, but you can also have radial nerve or musculocutaneous nerve entrapment that we want to rule out, that we can go on at a later time. And then, of course, you want to get in and you want to treat the fascia. So we're going to treat the whole fascial sling here, and we're going to focus a lot on extensor carpi radialis brevis, the supinator, and then, of course, remembering the flexors, because this is oftentimes the silent cause of this pathology.